Step 1 is the introduction. The pharmacist will introduce herself to the patient and then verify the patient's name and date of birth. At this step, the pharmacist will be telling the patient what types of tests will be performed today, and will also make sure that the patient has been sitting for at least 5 minutes or longer and has not consumed any caffeine, stimulants, or anything of the sort within the last 30 minutes. Step 2 is position. The pharmacist wants to make sure that she is in a relative close proximity to the patient. Also wants to make sure that the patient's arm is approximately at heart level. Both feet are flat on the floor. And that the patient's back is supported. Any of these could lead to a misreading of the patient's blood pressure. At this point in the encounter, the pharmacist will perform the pulse and respiratory rate. A good technique for doing this is to set a timer for 30 seconds. In this instance, Chisato is using her watch as a timer. For the first 15 seconds, you will check the pulse, and then the second 15 seconds, you will check the respiratory rate. When palpating for the pulse, it is important that you use your index and middle finger, not the thumb. When observing the patient's chest, you will look for the rise and the fall. It is important that you do not tell the patient when you are observing the respiratory rate as to not arouse any abnormal breathing. You will multiply each reading by a factor of 4 that should give you the reading that you have gathered for the encounter. Step 4 is the actual blood pressure reading. The pharmacist will place the blood pressure cuff on the patient's arm, making sure that it's not too tight or too loose, and that there is an appropriate cuff size for the patient's arm. To make sure that the arrow stating artery is directly over the brachial artery. At this point, the pharmacist will then ask the patient for the most recent blood pressure reading. Once the pharmacist has obtained the most recent blood pressure reading, she will then rapidly inflate the cuff to 30 millimeters of mercury above that systolic reading. Make sure you're in a proper position to be able to read the meter, or the gauge as it's often called, and deflate the gauge at a rate of 2 to 3 millimeters of mercury per second. When you hear the first knocking sound, that will be the patient's systolic blood pressure. Make sure to make note of that and continue to depress the cuff at a rate of 2 to 3 millimeters of mercury per second. When you no longer can hear any knocking noises, that will be your diastolic blood pressure, but continue to deflate the cuff 5 more millimeters of mercury before you rapidly deflate the cuff and remove it from the patient. You will then want to report the readings of the blood pressure to the patient and the pulse and respiratory rate if you have not done so as well. You will then use this opportunity to also answer any questions or address any concerns that the patient has